Well, welcome to another Webinar Wednesday, Thoughts on Theories. This is the fifth one in our series on theories. And today we're going to focus on using theory in case conceptualization. And so this is a really interesting topic because a lot of times when I'm teaching theories or when we're working with theories, we tend to focus on them one at a time. And really the practical use of theories is what difference does it make in your practice? What difference does it make in your day-to-day work? So that's what our focus is going to be today. The webinar will be a little different than most of our webinars in that we've got some slides that take us through some of the content up front, but then I'm going to present three cases toward the end of the session and show you how I might work with each of those cases using different theoretical perspectives and how that's going to change the outcome and the direction of our work together. So please do use that chat box or unmute yourself if you'd like and join in the conversation, especially at that point, because we want it to be really, really practical for you. Okay, so I'm Roberta Nault. I'm President of Life Strategies and also Associate Dean of the Faculty of Behavioral Sciences for Yorkville University. And as you can see on this list here, I've won a number of awards in the field. I've just recently come back from a very interesting opportunity where I was teaching career counseling to a group of graduate students in China, and then followed that with 2 international conferences, the Asia Pacific Career Development Conference in Tokyo, Japan, and then the International Association of Educational Vocational Guidance Conference in Tsukuba, Japan. And so it's really interesting to have been working, teaching, topics like this. I did a Thoughts on Theories presentation at one of those conferences with some of the other theorists from that special issue of the Journal of Employment Counseling. So it's been very interesting to have been working with theories, but in a very different context. And so I think that you'll probably find that I bring some of that into the session today because it's very fresh in my mind. So what is case conceptualization? It's a word that it tends to be used more in clinical practice or in medical circles sometimes than in career practice. But it's how folks in helping professions, so this quote or summary has come from something directed at counselors, but it's how any helping professionals would understand the nature of their clients' concerns, how or why the problems develop. So we're always making hypotheses around that. We're making guesses as to, where did this problem come from and what's going on. And then from that foundation, the types of interventions that might be helpful. So whether we use this term or not, anytime we meet with a client, we have some hunches. We're forming a picture of what's going on for this client and what's the underlying problem and where did those problems come from, and then how might we help this client. And this has become particularly important in recent years in the one-stop approaches to career development, where clients are coming in and they're not all getting the same type of service. You have to do some kind of a assessment up front, right from the very first time that the client reports to the office. You're doing an assessment of whether the client will be self-serve or will need to see a case manager. And then from that, you may decide that a client needs to see a case manager, and then in the BC system, that case manager would determine whether they're a tier 1, 2, 3, or 4 client. And so what is going on there, even though we might not use the language, is case conceptualization. But sometimes that case conceptualization is atheoretical. It's not really grounded in theory. And so a career practitioner who understands career theories can take all that theory knowledge that they've acquired through taking a theories course or reading on the topic, and then can actually use that to make the case conceptualization even more comprehensive. And that's what we'll be talking about today. So the different terms, you'll sometimes hear the term diagnosis used, again, much more common in a medical setting. So if you're working, say, in voc rehab, then you might hear that language used a little bit more often. What is more common in the career development field is to use the term assessment. And so an assessment, an intake assessment, for example, would be a tool for describing client needs. Case conceptualization is therefore a tool or a model for understanding those needs. So if someone has described to us what's going on, what we need to do is wrap our head around what's going on, and that's the case conceptualization. And then intervention planning, or some might use the term treatment planning, the intervention planning is figuring out what to do about those needs to bring about change. So a very simple example could be a client that comes in and says, here's a job ad that I want to apply for, but it says to send my resume and I don't have a resume. So the diagnosis or the upfront intake assessment would be this client needs a resume. The case conceptualization, so how we understand those needs, from a theoretical perspective, we might look at it as a developmental ages and stages thing. This is a kid that's never had a resume before, and so it's a normal developmental stage to write your first resume. Or this is an adult who's been working in one job for quite a long time, has got laid off because the industry has changed, and perhaps needs a resume, but may also need some career planning support. And so again, we might be looking at that through a developmental lens. We might look at it through happenstance, that this client has suddenly lost his job, has stumbled across an ad that looks good, hasn't put a lot of thought into it, now needs a resume to match the ad, and hasn't really got a lot of skill or knowledge about career development, but we're understanding that from a happenstance perspective, and so on. And I'll talk more about that with some specific clients later on. And then at the intervention planning level, the decision I might make is, would this client benefit from just some individual support writing a resume? And so I would be continuing with my assessment. Does he or she have good computer skills already? Are they going to be able to sit down at the computer, perhaps with a template, and populate it? Do they have good literacy skills? Do they really not understand the concept of resume at all? Like they've just never had one, never seen one, don't really get what the job ad is asking for. In that case, I might want to sign them up for a resume workshop and give them a little bit more support, more structured support around writing a resume, a generic and a targeted one. And so you can see how my intervention planning is going to fall directly out of my assessment or diagnosis and my understanding of what's going on for this client and the tools available for me in terms of interventions. So it's case conceptualization is like the middle part of a process. The purpose of case conceptualization is that it guides assessment and interventions. So again, if I take that example of someone who pops in with a job ad and says, I need a resume, it may be really clear from our conversation that this job isn't even remotely suitable for this client, in which case I might decide that the client would benefit from further assessment, perhaps some career planning support, and understanding a little bit about themselves and about the jobs that are available. It could be that the client has come in signing up for a full 2-week workshop, and yet it's really clear that this client only needs one small piece of that. And so my case conceptualization allows me to zero in on what kind of support the client would most benefit from. And other examples like that would fall out of that guiding assessment and interventions. It also highlights risk factors and also the strengths and protective factors. And so if I have a good understanding of my client's problem and also their strengths, then it's going to really help me zero in on the most appropriate interventions for that client. It supports collaborative goal setting, so working together to set goals. it anticipates and addresses potential barriers. So by having a theoretically grounded case conceptualization or understanding of what's going on for my client, it can help me figure out, well, gee, other clients at this stage of development or other clients who have, found themselves in this similar type of transition, whichever theoretical model I might be using, it can help me link this individual client with another group of clients that have gone through a similar process, and I can make some strategic guesses about how best to help. It also supports progress assessment and feedback. So if I have a theoretical understanding of what's going on for this client, then I can also imagine some logical ages and stages of, ongoing milestones that I might be looking for. And so if I would expect that if we do A, B will happen, because I'm working from a theoretical framework, then I can measure my client's progress from, at that B point and say, did the client achieve the milestones that I was expecting or looking for? Case conceptualization, depending on the model or framework we're using, also helps us recognize the impact of development or culture or ethnic or race factors. And so if I'm taking a culture-infused approach, for example, and we'll speak about that in a moment, then I'm going to be looking at the client's problem through a very different lens than if I'm taking a very Western approach to, what a client ought to do as they're looking for work. It also facilitates communication and coordination amongst team members. And so if we're all working from a similar model or understanding of what's going on for our client, then we can sort of talk in shorthand and, use terms that are familiar to all of us. So just for example, this isn't a, overall career development theoretical framework, but if we've been working with a group and everyone has done a Myers-Briggs, then if we're using language like extrovert or introvert, we know what that means within the context of that particular measurement tool. If we say, oh, the person was a high S, which is sensing in Myers-Briggs language, it actually means something to other people on the team who know that that person is probably going to need a lot of detail up front and really is going to pay attention to factual data. And so by understanding or working from a similar theoretical background or case conceptualization framework, then it's going to be easier for us to be working consistently with our clients. So the process in case conceptualization is, first of all, to evaluate the client's concerns. I know in other webinars I've introduced the 4 stages of learning model where we all start in we don't know what we don't know, or unconscious incompetence. And many of our clients come in at that stage, so they'll ask for something that really isn't the best intervention for their current needs, but it's what they know. So they know that people come to your office to get a resume done, or they know that people come to your office to attend a workshop or to get some counseling, or they know that people come to your office to get referrals to jobs. So chances are they've come to you because somebody has suggested that they come to you, and you've helped that other person, or you've helped someone from that other referral source or agency. And so they probably have a very narrow understanding of what it is you do. And so when a client comes in and asks for something, we don't take that at face value. A good intake assessment or needs assessment is going to go beyond what the client is asking for, saying, okay, that's one really important and good piece of information, but what else do we know or do we need to know? And so in this case, we might include our observations, or we might include some information that was already available in the client's file or as part of a referral source, or we might ask the client some questions and probe to go a little bit deeper. And then the next step is that once we've gathered that information, we're going to organize that information in some kind of a meaningful way. So a case manager might do this in, case notes or in developing an action plan. Someone at the front desk might do this less formally, just by, taking a moment to pause and reflect and say, well, based on this information, here's what I can suggest to you. Someone who speaks to a client briefly in a phone call, for example, is doing this, maybe making some notes and maybe doing, mind map with those notes and creating some circles or lines on the paper connecting things. And so what they're doing is organizing their thoughts around the information they have around the client. And then we're going to turn to theory to say what theory would help us interpret or explain what the client is experiencing. And so we're not going to necessarily share that theory with our client. The theory is a tool for us to organize our thinking and figure out what the next steps might be, or what would be a logical place to go with this client. So a typical case conceptualization model might start with reviewing the background information or the reason for the referral or the reason the client walked in the door to your center. Then you'd look at the presenting problems and the level of functioning. So for example, we've just had a student in our online course that was referred by an insurer for some upgrading or retraining. But in the first course, it became really clear that the student was having some cognitive difficulties that were making it very, very challenging to be successful in the course. And so, sometimes the client is going to present with a level of functioning that wasn't immediately apparent in the background information or the reason for the referral, but that's going to impact whether or not the client is going to be successful in the goals that you've collaboratively set together. Comorbidity is a term that you're going to sometimes hear. I mean, it's used a lot in healthcare, but you'll sometimes hear it with, say, a client that is looking for work, but also is struggling with addictions, or a client that is has been diagnosed with schizophrenia, but also has a challenge with an alcohol abuse, which is offsetting the effectiveness of his or her medication, for example. And so sometimes what happens is it's not until we're working with a client for a little while that we start to recognize that there's some other stuff going on, and that sometimes maybe that other stuff needs to be addressed before we can move forward with our intervention plans. We also want to pay attention to the present and past stressors. So is this client someone who might have some residual effects from trauma, for example? Is the client in a really unstable living situation such that it's going to be very difficult to maintain a job even after he gets one? And so we really want to pay attention holistically to what's going on in the client's life as we're trying to conceptualize the case. We also want to look at past and present interventions. And so has this client previously attempted career retraining? Has the person previously been through a career decision-making workshop? What were the outcomes of that? Why did it work? Why didn't it work? Why would it be needed again now? And so if we can do a comprehensive case conceptualization, we'll have a better idea of how to be strategic about next steps with our client. We definitely want to look at strengths, but also to look at risks and the protective factors against those risks. So if I'm working with a client who's had an addiction problem in the past, but is now living in a really stable environment and is actively engaged with an AA program and has 2 or 3 really solid people to connect with on a daily basis, then I might say that those protective factors offset the risks and that they'll be in a better position to cope with a career change going forward. As part of my case conceptualization model, I'm also going to pay attention to the outcomes I'm trying to achieve and also any outcomes that I have achieved at milestones along the way. And we'll look very, very carefully at any barriers that continue to exist or things that we might need to address in order to help our client be ultimately more successful. So when we look at case conceptualization through a sort of broader framework, the helping professional, in this case, their conceptual lens is connected to assumptions about problems. And it's this set of assumptions or the framework that holds together the process of therapy, or in the case of career development, that holds together the process of the work that we're doing as career development practitioners. Within any theory, therapists or helping professionals hold distinct assumptions that lead them to understand and view what's occurring in the therapy room. And so if we look at this from a broader career development practitioner's lens, what this is saying is that we bring our own assumptions to the room. If I have a value that most people, most adults ought to be working and are capable of working, and that there's work out there that suits a wide range of abilities, if I come in with that assumption, then that's a different starting place than if I come in with a belief or a theoretical framework that people with disabilities, for example, should be cared for by society. They should be fully funded by society and shouldn't be expected to work and support themselves. You can imagine, as a career development practitioner or voc rehab consultant, I'm going to come up with a very different game plan, a very different set of goals and interventions, depending on those assumptions that I bring to the room. And that's why it's so important for career practitioners. If you think about Mary McMahon's systems theory framework, she really emphasizes the importance of us being aware of all of the systems that are impacting me as an individual career practitioner, but also all of the systems that are impacting my client in the room. And she does a wonderful sort of living sculpture with presentations. Mary McMahon is from Australia, and I've seen her do this several times, where she brings people up to the front of the room who are representing these different systems. So, you're part of a family system. So we've got your family up there, and you come from an educational background. So we've got your education up there, and we've got, your gender is impacting it. So we put your gender up there and your age, and these are all different people wandering around the counselor and the client that are sitting across from each other. And it really helps to illustrate how complex the intervention or the interaction is between a career practitioner and his or her clients. And that's really what this quote is saying, that our conceptual lens leads to us making assumptions about the problems. And those assumptions are what we're going to work with. That's the framework for our work together as a career practitioner with our client. And so within any theoretical perspective, we're going to have very specific or distinct assumptions that help us view what's going on. And so that's why case consultation is so important, and supervision is so important, because if somebody else were to sit down with the same client that you've been working with, they might view the problem and the solution quite differently than you would. It's not that one is right or one is wrong necessarily, but it's that we're all coming at it with such different assumptions and ways of looking at the problem. And so if you have a chance to talk to other people about it, especially if you're stuck and what you're doing doesn't seem to be working, then that would be a really good indicator to reach out for supervision or consultation. So when you are selecting theories, you would have to decide whether you're going to work from one theoretical perspective, or whether you're going to pull a couple of different theories together that seem to fit with this client, or whether you tend to work more from an eclectic approach that just mixes and matches stuff and, interventions, activities, assessment tools from a variety of different theoretical frameworks. Or if you tend to take a very brief solution-focused approach, and that's going to shape your work together. So you come in, looking for what's the immediate problem. How would it look different if the problem was solved, and how are we going to get from here to there? So this is a Wordle, which is an activity that you can do online that just puts in. We put in a lot of different theorists and their theoretical perspectives. And you can just see how many you're working from. So, Hansen, we've talked about before. Sunny Hansen has her, 6 sort of core tasks in her life planning theory. Deirdre and I, Nault and Pickerel, have written about career engagement, and certainly that influences how we work with clients. We always have it filtered through our career engagement framework because that means a lot to us. Many of us use Krumboltz's happenstance learning theory and, talk about the importance of moving forward. John Holland's RIASIC model, realistic, investigative, artistic, social, enterprising, and conventional, is the foundation of many different assessment tools. And so if we're working from that model, we have more of a matching perspective or a trait factor perspective. Norm Amundsen really believes in active engagement and taking career support out of the counseling room and into real environments. Nancy Arthur and Sandra Collins have their culture-infused approach, which they wrote about in that special issue in the journal, but they also have written about in the Canadian textbook, and they have a whole book on culture-infused counseling that's really good. Nancy Schlossberg has her 4S system, where you look at the self and supports and a variety of other things as you're trying to explain how someone's coping with transitions, where Bill Bridges has a different transition model where he looks at the beginning, the neutral zone, and then the ending. And so we can conceptualize what's going on with the client by understanding or identifying which of those zones they might be in. I already mentioned Mary McMahon's work with systems theory framework, and she's done that work with Wendy Patton. Mark Savickas has taken a career construction approach to counseling, and so he tends to look for story and follow a narrative and look for heroes, that kind of thing. Ginsberg and then Super both have had developmental or life stages approaches. Vance Peavy, sociodynamic theory, and Jung's action theory also offer different perspectives. Frank Parsons was the original trait factor guy. Mark Pope has written about career counseling with underserved populations. Fred Young has a cultural accommodation model, saying essentially don't throw the baby out with the bathwater. If there's something good about the model you're using, use it, but then accommodate it to the unique culture of the individual you're working with. Radikoff and Magnuson have written on coherent career practice. Larry Cochrane has a narrative approach. Bright and Pryor talk about their chaos theory of careers. I've written with Norm Amundsen and Spencer Niles on career flow. Deirdre's written on employee engagement. Csikszentmihalyi has a flow model. We've already talked about Super. So all of these different approaches and many, many others that you might draw from are going to influence how we conceptualize what's going on with our clients. And so what I wanted to do was take a few minutes and introduce some clients to you and illustrate how your different theories are going to work with these clients. So here's an example of Jasjeet Singh. And what we originally know about her is that she was a stay-at-home mom. She has 4 children. 2 of them are now in college, and 2 of them are about to graduate from high school in the next year, like couple of years. She was recently divorced, and she's also recently returned to school and will be graduating soon. And so if we were to think about Jasjeet's case from a culture-infused approach, then we probably would want to take the time to explore with her what the meaning of work is in her life. So if she has seen her role as being, a mother primarily and someone who is caring for her children, then, how does she see that role changing now that her children are grown, and what would the next stage of her life be? We might also find out through talking with Jasjeet that in fact she'd never seen that as her role, but her husband had seen that as her role. And so perhaps she's delighted to be having the opportunity to move on to work. So I really don't want to go into this with assumptions. I want to, I don't want to say, oh, well, what I know about the South Asian culture is. Instead, I want to know how Jasjeet sees herself within the South Asian culture. And so what parts of that culture really fit for her, what parts don't, and how can we work together to help her make a meaningful transition. So from a culture-infused approach, I'm really wanting to explore culture. I might also conceptualize her case through a transition approach. So for example, if I use Bridges' model, I might want to, she's going through a lot of transitions right now. She is going through a transition of becoming an empty nester. So that's a big transition for someone who's been a stay-at-home mom. She's going through a transition in terms of her marriage. She had a fairly long marriage, and now that marriage has ended. So I need to, if I'm working from a transition model, I need to explore what that looks like for her. She also has recently returned to school and is about to graduate. So I need to look at that school to work transition as well. And so if I was working from just a transition model, I would be working with Jasjeet about, what needs to end, what does she need some closure on, what's going on for her in the neutral zone as she's in the midst of the transition, and what might be some indicators for her of the new beginning, and how will we celebrate that, or how will she celebrate that. So from Bridges' transition, I'm taking a very different approach than when I take the culture-infused approach. I could also choose to mix them together and say, what do each of these transitions look like through the lens of her culture? And then in a culture-infused approach, I'm also paying attention to my own culture. So what's going on for me, and what beliefs do I have about, a mom's role with her children, or about divorce, or about returning to school as an adult student and working after graduation. So I need to recognize that I'm bringing some biases, and I'm bringing my own experiences as a mother and as a wife and as an adult mature learner to this. And so I need to sort through how much of what I think is going on for Jasjeet is my assumption from my own experience, or my assumptions about what would be typical in her culture, and how much of it is actually specific to what's going on for Jasjeet. So if I take a culture-infused approach and use Bridges' transition model, it kind of enriches my work with her and my understanding of what's going on. I could further complicate this by bringing in Sunny Hanson's 4 S's, and we could say, what's going on for Jasjeet herself. How is she feeling about all of these transitions? What supports does she have in place? So, financially, one of the things that I know from a more in-depth conversation with Jasjeet is that she has been receiving alimony and child support, but that's going to end as the children finish high school. Then they get the additional support money themselves as they're in university, but doesn't come to her. So she's going to be in a very, very different financial situation soon than she has been for her entire adult life. And so that adds in more information by bringing in some of the questions from Sunny Hanson's model, or from Nancy Schlossberg's model. Sunny Hanson talks about these various, tasks in life. And so I might want to explore with Jasjeet a little bit about the meaning of work for her and what she sees as her life purpose. And it also, reminds us to look at health and, some other very practical things that I might want to explore with Jasjeet. Or I could look at the complex systems that McMahon and Patton remind us are involved in career decision making. And so, we could explore, again, I know from further conversation with Jasjeet that she's not even sure where she wants to live, because if her children go away to college, does she want to stay near where they grew up, or would she rather go and live close to where they're going to school? So she's got some pretty complex decisions to make about where to live, and that, of course, will impact where she's going to work. And so by bringing in some of those other systems, it helps me to expand on my understanding of what's going on for Jasjit. So that's just an illustration. I could have picked any of the dozens of theoretical perspectives to work from, but you can see that my understanding of what's going on for her and my understanding of how to help is going to be very much impacted by the theoretical perspective that I'm bringing to this work. Before we move on, do any of you have any comments or questions or additions just to this case? If you were looking at this case from your own theoretical perspective, what might you be interested in? What questions might you ask? Just going to pause for a minute in case somebody's trying to type. If not, I'll move on to the next case. Okay, so another case is quite different. This case is Ivan Petrov, and Ivan is 56 years old, and he has worked for more than 30 years, so almost his whole adult life, in electrical engineering, and more recently as a manager. His company is restructuring, and he's anticipating early retirement. He's married. His adult children don't live nearby. He has no hobbies. His family, other than his immediate family, is in Russia. And so he just doesn't know what to do. He's about to be laid off. He doesn't have any hobbies to fill his time, so he's thinking that maybe he wants to continue working. He's just not sure. And so he comes into you for some tests. He's heard that tests can tell you what to do, or tell him what to do. So if that's the information that you have about Ivan, your theoretical perspective is going to make a big difference. So if he's asked for tests and you're a believer in Holland's Riasek model, for example, you might want to pull out a self-directed search or a strong interest inventory, because it'll be important for you to figure out, is he realistic, is he investigative, enterprising, social, etc. It'll be important for you to find out something about him so that you can in turn match that to another job. And so if you're going to follow his lead where he's interested in testing, then the more you find out about him, the more traits and characteristics that you can surface, and the more you know about the world of work. And if you found ways of categorizing that, the world of work, like with a Holland dictionary, then you would be able to do some matching for him and say, well, here's a list of occupations that might be a really good fit for you. So from the Riasek model, that might be where you would go. So that's Holland's person environment fit approach. If instead you tended to be more of a developmental theory follower, so you're saying, well, Ivan, you're 56 years old. According to Super, you're sort of at the end of you're nearing the end of your career. You're someone who's had more than 30 years with the company. You're probably going to get a good package as they're calling this early retirement, so you're probably going to end up with a bit of a pension. Maybe it's time to call it a day. It's really normal for people who are in their late 50s, early 60s to be considering retirement. It's a developmental stage that you're beginning to disengage with your career, and they're just helping you out here, and how lucky that you're getting to leave early and you're getting a bit of a package. Your children are grown and not dependent on you anymore. And so what we need to focus on for you is just how are you going to be comfortable with your retirement. And so in terms of tests, maybe I want to pull out a tool like career life skills, resources, retirement dimensions. Or maybe I want to look at some interest inventories and see if we can surface some ideas for hobbies, like maybe looking at the career exploration inventory or Holland's leisure activities finder. And so if I'm working at this from a developmental perspective, but I'm mixing in a little bit of the person environment fit, then I might be focusing on how to keep them happy in retirement. If I was focusing instead on the career flow model that underpins the work that I did with Spencer Niles and Norm Amundsen, that's a different approach because it looks at, has he done enough self-reflection? Does he know himself enough to know what the next steps are? What about exploring other possibilities? Does he know enough about the labor market in his community? Does he know enough about what other opportunities might be available? Does he have the tools he needs in order to move forward? Are there any supports that we would need to work on if he were going to switch careers right now? And so what happens with using the flow model, also I would want to remember that hope is at the center of the hope-centered approach to career development, which is the backdrop for career flow. So how is he feeling about this transition? The company's restructuring. It really wasn't his choice. He's been with the company for a really long time. What's going on for him? What hope does he have for the future? Is he feeling good about his opportunities? Is he scared? Is he depressed? And so if I take a hope-centered approach, it's going to change my work with him. It's going to change the focus or the flavor of my work. If I were to apply Deirdre's and my career engagement model, career engagement believes that skills and capacity need to be fairly well matched in order for someone to achieve career engagement, which is the optimal place to be. And so I might be concerned about this 56-year-old manager who has been working for almost his entire life for one company. What's going to happen to all of those skills if they're not used going forward? He doesn't have hobbies. He doesn't have children who are dependent on him right now. And so when he has low challenge and yet high skills, he's going to be in that underutilized part of the career. Hi, Francis. He's going to be in the underutilized part of the career engagement model. And so what are the implications of that? If he's feeling underutilized, might he move into being disengaged? Might he end up, perhaps moving into a state of depression or hopelessness? And so I might have some real concerns if I'm framing this with career engagement about how am I going to increase the challenge for him. I might want to help him identify some new hobbies that he can really engage with. I might help him identify some work that's going to be interesting for him, that will use his skills rather than him just settling for whatever is available. I might even work with him to explore the possibilities of going to, back to school and maybe engaging in some learning that he hasn't had the opportunity to do before. So again, my theoretical framework really will influence my approach with this client. The last client I wanted to practice with is Suki Loh. And Suki is quite different than the other two who were sort of later in their careers. She's an absolutely brilliant international student from China. She's been very, very active in the International Student Association. Her parents have supported her all the way through school. They see it as her job to be a student and their job to support her financially. And she's been very happy to be in school and to engage in everything school has to offer. Her goal is to continue to live and work in Canada, and her visa does permit her to do that. But now she's come to you because she's realizing that most job ads and most job application forms are asking about her work experience, and she doesn't have any. She never had a student job. She didn't work while she was in university. And yet now when she's applying for work, it seems like a really big deal that they're looking for work experience. So if I'm going to work with Suki, I might start with a culture-infused approach simply because she's someone who is an international student here and probably at the very least bicultural and maybe even has other cultural influences that I'm not aware of yet. And so I would want to understand for her or from her what work means to her, what cultural expectations may be influencing the next steps in her career. Are there some jobs that are considered suitable and some not? Are there any expectations around how much money she earns or whether she would engage in further education? So I really would want to have a bit of a cultural understanding of where she is, and particularly because she's from China and her parents have been supporting her financially, it will be important to understand what her parents' expectations for her are as well, because she's unlikely, although, I'm not going to make the assumption without checking it out with her, but she's unlikely to be making a career decision in isolation. She's likely to be consulting with her parents on that. So from a culture-infused approach, then I also need to pay attention to my own assumptions or biases as someone that started work when I was a teenager, and my children started work when they were teenagers. And so I have to, recognize that I've had a very different approach or belief to, working while being a student. And so how is that going to influence my assumptions about Suki and supporting her moving forward? So a culture-infused approach in this case is just going to help me figure out what influences we need to pay attention to. I might also want to look a little bit at Crumboltz's happenstance learning theory with Suki and say, from a happenstance perspective, we may not pay so much attention to the advertised jobs, but we may want to try to surface some of the unadvertised jobs or the hidden world of work. And so how are we going to do that? Perhaps through contacts. And so she's had high visibility in the International Student Association. She's an A+ student, so she probably has has really impressed some of her professors. She's probably been an amazing person on group projects. And so if she gets in touch with some of those students that she worked with, they might be able to give her a really good idea of, contacts, or they might be willing to vouch for her with their employers. And so by taking a happenstance approach and recognizing that it takes action to create opportunity, I might be able to help Suki build on the network she's already established and open up opportunities for herself. From a career construction approach, if I want to follow Savickus's work, then I might look at, what are some common themes in, the approach that she's taken to various projects she's worked on or groups she's been in, or her approach to studying in a different country, and what can I surface as some common, strengths that she might have, or how has she successfully navigated transition in the past. And so by looking at her story and really listening for the underlying story, I might be able to pull out some themes and patterns that will give her some clarity moving forward. From a career engagement perspective, if I look at Deirdre Pickrell's and my work, I would be really concerned for Suki, just as I was for Ivan, about how she was so highly skilled and would have had enough challenge in university that she would have been in that real engagement zone. My concern would be if she ends up taking an entry-level job, that she might feel quite underutilized. But with no work experience, if she takes on a job that other university students might take on, maybe it's overwhelming for her because she hasn't had the prior maybe 8 years of summer jobs that would have given her an understanding of what employer expectations are or how the workplace operates in Canada. And so I really need to work with her from a career engagement perspective to try to find the right balance of skills and challenge that's going to keep her fully engaged, and to help her figure out how to make adjustments along the way. If she gets a job that's not that interesting, how can she set herself some personal challenges to make sure that she stays engaged during that transitional time. So those are just 3 examples. We could have chosen dozens to go through, but I hope that that's given you a little bit of a perspective on how I might use case conceptualization to work with clients, and how the different theoretical approaches I use are really going to change what that work is going to look like. Oh, here's Brad. Sorry, I thought that I had 3 cases and I've actually got 4. So Brad was a very interesting one I won't go into in a lot of depth, but he worked in road construction for 25 years, left school early, didn't complete his GED and hasn't needed it because his work has just continued in road construction. But when he was snowboarding with his teenagers, he hurt his back and now he has limited mobility. He really wants to return to work. EI isn't covering his expenses. But here's an example of someone who is not able to return to the same work he's done before, and he's not very well educated. And so what options are going to be available for him? So if I look at this through a happenstance lens, clearly unexpected things happen, or I could even apply chaos theory to this. Unexpected things happen. If I look at it developmentally from Super's model, he's almost going back into a mini cycle because now he needs to explore new career possibilities that he hadn't considered before. He may find that he needs to return to school, and so probably looking at this through a transition lens would also be helpful. And so I can draw from a variety of different theoretical perspectives to help figure out what's going on for Brad in this kind of a voc rehab scenario. So some theoretical cautions are recognizing the bias that's inherent in a variety of theories. Sorry, this should be animated and move through it, and it's not. But presenting a holistic approach. So, you've seen how I've drawn from theories and combined theories, recognizing that most theories have a variety of different central components, and making sure that the theories that we're picking are integrated according to our client's needs, so that we're not just, whole hog importing a theory and saying, well, this is the way I look at things, and so I need to fit you to the theory, but instead having enough theoretical training behind us that we can find the most appropriate theory to help us conceptualize or understand what's going on for our clients. So that's the end of this case conceptualization, or using theories for case conceptualization, part of our Thoughts on Theories series. I look forward to continuing the theories discussion with you, and also for some of you who are in a variety of our webinars with carrying on with some of the conversations on ethics and assessment and organizations. So we do have 4 topical streams, and we have a webinar almost every Wednesday at lunchtime, 12 noon to 1 p.m. Pacific. So I do look forward to working with you in future sessions. Thanks for joining us today. And if you've got any questions, do feel free to unmute yourself or to just enter them in the chat. I'll just stop the recording right now.